I'm with Dr. Adam Peets, Clinical Care Medicine Fellowship Site Director at St. Paul's. What are we about to see, Dr. Peets?
So this is a training session with our critical care medicine fellows, and what we're going to be doing is resuscitating our simulator here and having a educational session so that our trainees can practice on something other than a real person and learn from it.
Fantastic.
Okay, so Dr. Rush, we're going to ask you to go inside and resuscitate this patient. The code has been called in the CCU for you. Let's go in.
Okay. Hi, we're from the code team. Jen, the RT, can hook up the monitor, get an IV.
Hey, I'm your nurse. Let me know what
you're the RT. Oh, you're the RT. Okay. Can you get on the airway? Can you hook up to the monitor? Check the blood pressure. A full set of vitals. Let's get some oxygen on. That could be a first set of vital sats. What's going on, sir? I have a pulse. Do we have other members of the code team to come in and help as well?
Are you having trouble breathing?
What's bothering you, sir?
Check pad. Let me Dr. Rush.
Oh, hello. Can you get the chart and please call for an EKG as well as stat blood work and chest X-ray, please?
Okay.
You need some help? Yes. Can you go through the chart and tell me what this patient's admitted for?
Stat blood work, ECG, and a chest X-ray, please. All right. I've called for X-ray, ECG, and blood work.
Okay. Can you draw up some phenylephrine and some drugs for intubation?
Okay.
Some ketamine and some rocuronium, please. How are you doing, sir?
How much, Dr. Rush?
Sir, he's an 80-year-old with aortic stenosis. Came in with heart failure.
Okay.
I know about a week. Admit him for diuresis. What I can get from the chart.
Dr. Rush, your blood pressure here, it says 86 on 45.
Okay, can we give 200
Your heart rate's
phenylephrine?
182. I got him on the monitor here.
I got the phenylephrine.
Okay.
Just let me know what you want me to do.
Let's prepare for cardioversion. Can we get some, is that ketamine drawn up?
I've got ketamine, rock, and phenylephrine drawn up.
Do you want me to get ready to bag him? I need the bed pulled out.
Yes, let's pull the bed out, please. And we have good IV access? Do we have good IV access? Andrew, do we have
Yeah,
good IV
sir,
access?
you got ACF on the right.
Okay, can we start a liter bolus of fluid, please?
Sure.
And Eric, can you please put your finger on the pulse and tell me if it stopped?
He stopped talking.
Is he still awake?
He has a really rapid pulse right now.
Yes, I think we have an SVT here, an unstable hypotensive with severe, was it severe aortic stenosis?
Okay, my friend, I'm going to just put this mask over
We
your
need to be
face
worried
here.
about keeping his afterload high.
Just keep breathing, it's just oxygen.
So I'm going to prepare to cardiovert this patient. What medication?
How would you like me to do that, sir?
Let's sync the monitor there.
Okay.
And we'll shock at 200 joules when I tell you don't shock until I say. And we'll give him ketamine for sedation.
Can we get the sat probe on the patient?
How much
please?
ketamine?
How much does the patient weigh?
70.
And
70
can you put
kilos?
the sat probe on the patient? Please?
Sure.
We're going to give 100 milligrams, don't give it yet, Eric. We're going to give 100 milligrams of ketamine for sedation. See the sat probe in there?
Okay.
And then we'll prepare to synchronize cardioversion. And can we switch the blood pressure cuff to run every minute?
I'll do that.
Done.
And he's on
Okay, your sat probe is on.
a full, he's on 15 liters by the minute.
85%, so he's...
So our O2 sats there
Sir, are you
are
okay?
Just plugging
Can you
in the
still hear me?
computer.
85.
He has a pulse.
Plug into the computer.
He stopped talking.
Oh, it's already synced.
Can somebody listen to his chest as well? Tell me what it sounds like.
Who would you like to do that?
Andrew,
have
could you
a
please do
stethoscope.
I'm just the nurse, so but I'll have a listen.
Sure.
I don't have a stethoscope.
No one has a stethoscope? That's unfortunate.
I'll percuss him for you.
Okay.
Poor pad contact.
All right. Well, here. Okay. Team. Hussam has a stethoscope. There we go. Perfect. Let's listen to his lungs quickly, and then let's prepare to cardiovert.
Okay, I've got it synced here for you. Just let me know what you want me to
Sure.
do.
Can we also, can you drop some Lasix?
He's got some
too?
wheezing.
How much would you like?
Drop 200 milligrams of Lasix.
Would you like me to give it?
No, do not give it. And Ken, what was his last creatinine?
Mr. Hunter, can you still hear me? Are you still
120.
okay?
Okay. Let's prepare to
Hunter?
cardiovert this gentleman. Okay. So, Eric,
Here's that Lasix.
perfect. Eric, can you give 100 milligrams of ketamine, and
Okay.
Andrew prepared for synced cardioversion at
Where's
200
synced?
joules.
Okay, I'm giving 100 of ketamine and pushed it in now.
Okay, thank you.
Okay, just let me know when you want me to charge it up.
Charge to 200. Lay the bed down. Okay, everybody clear? Okay, clear. Shock, please.
Truck delivered.
Okay.
And
feel like it's,
is there a pulse?
This oral airway in.
He had a pulse, but it's very weak,
Is there?
and
I
now
don't,
it's
I don't, I
absent.
don't feel
Yeah.
a pulse.
Now
Okay, can
it's
we start
absent.
CPR, please? Can we get a milligram of epinephrine drawn up? Do not give it, please.
All right, I'll draw
Can
that
we
up.
draw 2 grams of magnesium, Ken?
Here's your epinephrine here.
As well as get 300 milligrams of amiodarone ready, please. Do not give any medications yet.
Okay, I have a mag.
And
The amiodarone is going to take me a couple minutes to mix
okay.
up here.
can we have another person for timing, potentially?
Okay, I got your amiodarone
Sam,
and
could
your
you
epi.
please record in time and tell me after it's been 2 minutes of CPR? Thank you.
Let me know when you want that epi.
Okay, please give, well, let's wait and do a pulse and rhythm check in 2 minutes,
I
and
don't
then
know
we'll
that I'm getting
decide.
a good seal. Could you bag for me, please?
I still have your mag here.
What was his initial rhythm? I thought it was VF.
Well, it was an SVT, I think.
After
And then after that, it was kind of, it was course something.
Is there a
And
bigger mask there, Andrew?
Ken and
No. This is the
Jen,
only mask you
could
have.
you also please prepare to intubate if
Yeah.
needed?
Can you get some? I can. Go off.
Okay, in 10 seconds, we'll hold CPR and we can check a rhythm. Can you check his pulse, actually? No, keep going with the CPR.
Keep going with CPR.
I'll tell you when to stop. Yeah, keep your finger on that pulse there, please, Sam.
Okay, 2 minutes.
Okay, can we stop and do a rhythm and pulse check, please?
Does anyone know where
No
this
pulse.
No pulse, no rhythm, that looks like VFib.
Check the drawers.
Okay, back on the chest, please.
Got that.
A milligram of epinephrine, please. 300 milligrams of amiodarone, please.
Milligram of epi is in.
We're on the VFib
Oh, there it is. I'm sorry.
ACLS algorithm. So milligram of epi's in.
In.
300 of amiodarone's in.
Alright, still mixing it up.
Okay, can we give 300 milligrams of amiodarone as well as 2 grams of magnesium?
Okay, we're set up to intubate whenever you tell us.
Okay, here's the.
Please go ahead and intubate.
At
Do
the
not
amiodarone.
interrupt CPR.
Do you want me to give him the amiodarone?
Yes, give that 300 milligrams of amiodarone, please.
You want to shock him?
No, we'll wait and at 2 minutes we'll do another rhythm and pulse check. And prepare to shock, yeah.
out.
No, just keep your finger on the pulse in a second.
Sure.
So are we ready to, we got the pads
Okay.
on?
Yeah.
Can we, okay,
Okay,
you got that
I'll
airway
switch
in?
with Eric.
Sure.
Okay.
Eric, can you get on the groin and feel the pulse
Yeah.
for the
Okay.
CPR? Okay, let's stop and do a rhythm and pulse check, and if
I
there's
need
no
the connector.
pulse, let's shock. So can we charge 200?
There it is.
You want to
Okay, let's hold CPR. Is there a pulse, Eric?
There's no pulse.
Okay, clear the bed and shock, please. Shock at 200.
Okay, everybody clear?
Shock. And then back on the chest, Suzanne.
Okay.
Right.
Shock.
So, I have him intubated, but the connector for the tube is missing.
It's over there.
Okay, well, we should rectify that.
We're just not gonna
I
stand
am
by.
essentially passively oxygenating him. Are you okay? This is not very good CPR. Thank you. Excellent, thank you.
Can we call for an EKG as well to be standing by? I think we called them earlier. And let's, yeah, okay. Has it been 2 minutes since our last CPR?
Yes, almost.
Okay, and we have good air entry, the tube's in the right place, end-tidal CO2.
Waiting for entitle. Stats are coming up, 93%.
To rush, 2 minutes.
Okay, 2 minutes, let's do a pulse check and rhythm check. Do you have a pulse, Eric?
I have a pulse.
Okay, we have a pulse. We cycle the blood pressure, please.
Cycling.
Entitle's 47.
Okay, good. Continue bagging. Let's call for EKG and chest X-ray right now to do the EKG and have them. Well, they're probably here, so they'll do an EKG. And we'll look for ST elevations and abnormalities.
We will call it there. Well done. All right, let's go next door and debrief.